Oh, yeah. Okay. Great. Well, thank you everyone for sticking around through that. We have figured out our technical difficulties and I will try and pick up where I left off. So we are still recording this webinar. And then the other thing I was saying is that the audience is in listen only mode. So please use the chat box if you have any questions or problems that come up. And if we have time at the end, we will be answering a few live questions from the chat box. And I also want to thank those of you who submitted some questions ahead of time, and we'll be answering as many of those as we can right now. And now I'll just do some quick introductions and then we'll jump right in. So for NEHA, we also have Laura Wilde, who is our Senior Food Safety Program Analyst, and she will be helping me out with the panel today. Now I'll move on to our panelists. So first we have Michelle DiMaggio, who is a Supervising Environmental Health Specialist from Contra Costa County, California. Michelle is a NEHA Region 2 Vice President and Food Safety Subject Matter Expert. Additionally, she is an FDA Subject Matter Expert and Temporary Food Establishments Course Trainer. More locally, Michelle is a liaison and responder for her department and division's emergency management and foodborne illness outbreak investigation teams. And she's also a regulatory member of the California Retail Food Safety Coalition. We also have Sandra Long here today, who is an environmental health manager from the town of Addison, Texas. She is a registered environmental health specialist, registered sanitarian, certified profession in food safety, a retail food standardization training officer, and she has served in various capacities with the Texas Environmental Health Association and the National Environmental Health Science and Production Accreditation Council. And Sandra is also the current NEHA president-elect. Next, we have Carrie Poyola, a retail food technical specialist from the Wisconsin Department of Agriculture. Carrie is involved with the Conference for Food Protection and currently facilitates the Wisconsin Department of Agriculture, Trade and Consumer Protection Food Safety Advisory Committee. And she's also the Wisconsin Environmental Health Association president-elect. And last but not least, we have Christine Silvis, an environmental health supervisor from the Southern Nevada Health District. She has been an FDA standard since 2009. She's been the Pacific Region local regulatory representative for the Conference for Food Protection Board since 2018. She's active on several national committees, and she's also been an active member of NEHA since 2006. So I want to thank all of our panelists for being here today. We really appreciate it. And now we will get started with our first question. And so our first question today focuses more on current times and whether you are currently doing inspections during COVID-19. And if you are, if you can speak on some of the modifications to normal practices, such as doing virtual inspections, high-risk only inspections, or complaint only. So let's start with Carrie for the first question.
Welcome everyone. Yeah, in Wisconsin, we are doing most inspections virtually unless social distancing can be practiced. Some inspections are also done in person. Those would be our tourist rooming house inspections, which are the cabins that we license and rent out. So if you see rentals on Airbnb in Wisconsin, those require a license from our department. Some of our recreational educational camps are also being inspected, or we're doing some consultation on how they could possibly open with practices in place for hopefully limiting the spread of the virus. As of now, all retail inspections are conducted mainly virtually, and we're focusing on those that are dealing with complaints and pre-operational inspections. Some guidance was developed by our department and distributed on how to effectively conduct those virtual inspections and what we would want to be looking for. Again, within our division, really the only inspections that are being done routinely are our meat facility inspections. Yep.
Great, thank you. And maybe let's have Christine go next on the same question.
Hi, everybody. As far as our food inspections are going, we are still currently doing food inspections. We did not stop them. We do have some options for our inspectors. If social distancing can't be practiced because of the size of the kitchen and the amount of food handlers in the kitchen, then they are allowed to do a survey with the person in charge in the dining room where social distancing can be practiced. So we are continuing those inspections, but we did put some modifications in. All staff are wearing at least a cloth face covering. And we also put a moratorium on our downgrade fees. So we're not charging for those right now. Closure fees are being assessed on a case-by-case basis by the supervisor to see if there's a reason to charge the fee, if it was just a bad day, or if there was some blatant disregard for food safety practices. As far as our pool inspections are going, we did stop those. The staff are coming back this week. They were assigned to another area. And childcare there's just a few staff that are doing spot checks on the childcare facilities, and we're also spot checking food distribution sites for schools.
Thank you. Michelle, would you like to go next, please?
Oh, thank you. For Contra Costa County, we are not doing pool inspections. Pools are still closed in our county. For the first few weeks from about March 16th through up to this Monday, the 11th, we did not do inspections. We were mostly responding to complaints that were urgent. For example, if there was an outbreak, recall ones, or imminent health hazards. Otherwise, the inspector would call the complainant, get some information, and then call the operator. And most of those were regarding social distancing, masks, gloves. As of Monday the 11th, our inspectors started going out in the field to conduct what we call food safety checks. And the name I got from another jurisdiction, but basically it's a shorter version of a risk-based inspection. Just trying to decrease the amount of time, however, maintaining social distancing at the same time. I told some of our inspectors, do the dance. If somebody's on one side, go the other, kind of do the line dancing kind of thing. But they started doing inspections, and again, it's based mostly on risk-based inspections. We changed our form just a little bit so they can concentrate on the risk-based inspections.
Okay, thank you. And finally, Sandra.
Good afternoon. So we have in the town of Addison in Texas, we are in Dallas County. Dallas County is one of the 3 highest places in the state of Texas with positive cases of COVID-19. So we are doing virtual inspections for all of our inspections right now. The only time we're doing an in-person inspection is where it's just not feasibly possible, like at a grocery store or something of that size. So otherwise, we are doing all of ours virtually. Our swimming pools, actually, I had done preseason inspections, staff had done preseason inspections also back in February. So that the beginning of the year, we're actually just opening them up, doing the chemistry and doing a follow-up. So those inspections are actually slated to start the beginning of June right now. Right now, pools in Texas are not recommended. The public pools are not actually open yet, but the private, semi-private pools are open. So those are the ones we're focusing on as far as getting them up and operating and making sure they've got all the guidelines that they need. When we put the plan in place for our virtual inspections, we went simple. We did not have anyone download any kind of special software. We are using our phones and our iPads. So we're doing them either on FaceTime or on Duo or Zoom, and it has worked out really well for us.
Great, thank you. So the next question is kind of a follow-up to this for those of you who are still doing some in-person inspections. If you could please speak a little bit on safety concerns that your teams have expressed and information you've provided on PPE or other types of procedures to help them with safety measures. So maybe we'll start with Christine for this question, please.
Hi, so we have made accommodations for staff that are concerned if they have underlying health conditions or if some of their family members in the same household are high risk for contracting the virus. They've been assigned to other areas, so we've assigned some of our environmental health staff to the Office of Epidemiology and Disease Surveillance, and they're acting as disease investigators and contact tracers. We also have some staff that are working solely on projects in the office right now, but we did ask any staff who do feel comfortable to go out and do inspections to do those, and of course doing the surveys as I mentioned before. All of our staff have been provided with cloth face masks, with multiple ones, so that they have enough to wash in between different days. And also all of our staff are in the process of being fit tested for N95 respirators. And they are being provided a limited amount of N95 respirators to use if they really feel uncomfortable about being in a situation. They're also provided face shields for that. Some of the inspectors did have some concerns about going in and doing inspections because I didn't know how we were going to be received by operators. But what we found is that it's kind of half and half. Half of the operators are a little surprised to see us and don't think that we'd be doing inspections right now, but we haven't had any incidents. And the other half are actually very relieved to see us because they say it's some sense of normalcy and they have a lot of questions to ask. So we are providing a lot of education on coronavirus right now. So it's been a mixed response to us being out there, but so far so good.
Great, thank you. Michelle?
Same here. We had some staff members that were really concerned about how are they going to provide social distancing in a small environment. So we provided our staff with a guideline, basically retrieving information from multiple jurisdictions as well as mostly from CDC, keeping up with CDC's guidelines and incorporating that in our guidelines, specifically, like Christine mentioned, providing them cloth face covering so that they can wash it, and also just reminding them about maintaining the space, giving them information about if you're in a small area, maybe you can switch spaces with that person, and meeting with them as a group using Zoom. I think their biggest concern again was their contamination, or they receiving COVID from somebody who might have it and not reporting it in the food facility.
Thanks. And then Carrie, if you have anything else you'd like to add.
Yeah, I would just like to add on pretty much what the other ladies have spoke to, but our department had actually developed a policy as well for temperatures. So we're seeing a lot of firms that are requesting temperatures be taken of inspectors before they enter the facility. So we want to make sure that they're following CDC and OSHA guidelines for taking those body surface temperatures. And also that we want to make sure that the business cannot retain our department protected health information, including the temperature readings. So we did also set forth that if a staff member submits to a temperature check that results in a temperature of 100.4 degrees or higher, that staff member has been directed to notify their supervisor, immediately go home and contact a healthcare provider. And also I'd like to add that the staff member will not return to work until they are free of a fever or signs of a fever and respiratory symptoms for at least the 72 hours with the use of fever reducing medicine, and 10 days have passed since symptoms first appeared. Also, we're just kind of leaving it up to a lot of our facilities too, that our staff and our inspectors adhere to the guidance that is set forth. So unless it's impeding inspections or they feel that it's going to provide a source of contamination, if that facility is requiring face masks, that our staff wear face masks, gloves, and you know, strongly encouraging hand sanitizer, and of course, good hand washing and personal hygiene.
Great, thank you. And I will open up the next question to whoever can speak on this. On outside of restaurants, what type of guidelines you've provided to other types of facilities such as schools, day camps, jails, or any other institutions?
This is Michelle DiMaggio. Myself, I've worked with a couple of school districts that made their own guidelines at the beginning of the COVID pandemic, basically guidelines on how to serve at different school sites. Most of our schools closed, but they opened certain schools to serve to not only the children, but some open to the public. So I assisted them with their guidelines and making sure that they stayed to the food code or California Retail Food Code.
Mm-hmm.
Great. Then if anyone else works with different types of facilities in their jurisdictions.
This is Carrie. We did provide some guidance because of course schools closed and they still wanted to provide meals for the students of how to safely deliver those meals, what they best practices for what they should be putting in those lunches and breakfasts, you know, just talking about temperatures, temperature requirements, anything that would have possibly needed reheating. We wanted instructions in the meal packs for those. We also developed guidance for our restaurants on how to properly and safely donate foods to pantries and shelters. And yeah, so we also have all those guidance documents on our department website as well that are available to anybody and everybody that would like to look at them.
Great, thank you, Carrie. So I think moving on now, we're going to start looking forward to how things are reopening and what that looks like. So the next question is what your jurisdiction will be doing with businesses that have had expirations in licenses or certifications. So speaking both on licenses for the businesses to be operating, but then also on lapses in certifications such as the Certified Food Protection Manager. And let's have Sandra go first for this one, please.
So for the food establishments, if they are currently operating and they have never ceased operation, then we are allowing up to a 60-day extension for their renewal. For those places that decided to cease operation and wait till another time to begin operating again, we're going to be allowing them 30 days after they begin or reopen for operation. Those would be places that, again, they voluntarily ceased operation just to kind of wait out the pandemic and see how things were going to go. As far as food manager, food handler certifications, those type of things, quite honestly, those are available online, and we're encouraging them to keep those current because right now, with so many of them doing curbside and delivery, and some of them coming up with really creative new ways to reinvent their food establishment, food safety has become a priority. So those are required to be kept current.
Christy?
As far as licensing goes, we're in the middle, coming to the end actually, of our permit cycle. Our fiscal year is July 1st till June 30th. So we haven't run into issues with food permits expiring right now. Obviously, there's no events that are taking place, so we're not issuing any temporary food establishment permits. As far as food handlers go, we do require a Southern Nevada Health District issued food handler safety training card for all food handlers, and managers get a food manager card based on a CSPN certificate. We stopped issuing food handler cards back in March. So we've just been very open. Any new food handlers to the business, we're not requiring them to get a card. And we're going to allow a time frame after we reopen to have those cards issued to new food handlers and those who have had their card expire while we've been closed. Right now, we're looking at about 90 days after our opening date for that.
Great. Let's go to Michelle next for the same question.
Yeah, for us, understanding the situation of our food facilities, March 1st was the beginning of the permit cycle. So for those who have not paid, we are not doing late fees. Usually every year there would be a late fee that's charged. Also for re-inspections, we will not be charging for re-inspections. We do have what's called a food safety refresher course. We have a placard system, and if the food facility receives a second yellow placard, before COVID, they would have to come in for a food safety refresher course, and we stopped that. But otherwise, that's when it comes to billing, that's what we've been doing.
And Carrie, to wrap up this question.
Yes, so our licensing period also runs from July 1st to June 30th. So we did send out renewals, and with the renewal, we sent out an insert, a letter stating that we will not charge late fees up until December 31st. So we're giving quite the grace period, it sounds like. So there won't be late fees or surcharges. So in essence, your license will remain in permitted status until December 31st, 2020. We are strongly encouraging that people do renew if they are able to do so by the June 30th deadline. If they're not able to do so and they plan to renew late, that they should keep a copy of the renewal notice for future use. As for certifications, again, we are giving a grace period of 90 days after our courses resume. In Wisconsin, not a lot of our certified food protection managers take online courses. Most of them are more comfortable in a classroom setting. So we are giving that grace period as well. If we've issued conditions on a permit because they haven't had a certified food protection manager, we are extending that conditional permit as well. And with regard to our recreational educational camps and our pools for lifeguarding, first aid, we're also giving a grace period as well for getting those renewals in place.
Great, thank you. Our next question is on reopening food establishments. And what you think that when you tend to resume usual operations and whether those things will be staggered. And also if there's any special measures that should be taken on the part of the establishment, such as cleaning and sanitizing or flushing pipes or things like that. So I'll open that up to whoever would like to go first.
Okay, I'll go ahead and start. I think the biggest concern, if facilities have been closed for what's been 6 weeks now or so, and if they had maybe one population, a small population of cockroaches, that population is going to be huge now. So that would be a concern, I think, going in. Hot water, if they're just starting up and they didn't turn on their hot water heater, it's going to be some imminent health hazards that I think the health inspector needs to consider when they walk into the facility. The operator may be anxious to open up and may not consider some of these when they start up again. So for imminent health hazards, our inspectors are required to close the facility.
Great. Does anyone else have other things to add on this?
Yes, this is Carrie from Wisconsin. I just want to echo what Michelle said. I believe it's after 3 weeks of standing water, I believe it's considered stagnant. So we are strongly encouraging that folks follow the CDC guidance for reopening buildings after prolonged shutdown. We've also included that into our guidance procedures. As for staggered reopening, we did run into a little situation. So some of our facilities are now open in full capacity within certain areas of the state. We did have a ruling by our Supreme Court that overturned our governor's emergency orders for safer at home. If there's time at the end, I can talk a little bit about that, but I'm sure if most of you are watching the national news, you've seen that Wisconsin is now, most areas of the state, except for those very urban large areas, are open for business, but a lot of our facilities are still kind of holding back on their practices and processes and taking things slow.
Okay.
So,
Let's see.
This is Sandra. In Texas, we are doing a staggered reopening where currently the restaurants can be open for dine-in, but at 25% occupancy only. Once they get numbers starting to drop, then we're talking about moving that from 25% to 50%. But currently dine-in is at 25%, and we're still encouraging the takeout, delivery, drive-through options for all of our facilities. And then again, the ones that have been closed for over 30 days, we are requiring them to flush their pipes and again, do a thorough cleaning, sanitizing, and pest control before they reopen.
Hi, this is Christine. So we are also doing a staggered reopening within the state of Nevada. We're in probably the middle of phase 1. We entered into phase 1 a few weeks ago, and it is limited to takeout and curbside pickup, but we do have limited dining available. So it's 50% occupancy within restaurants. A lot of facilities have decided to remain closed because that doesn't work for their business plan. Some of the gourmet restaurants are remaining closed. Currently, all of the casinos are still closed. They are going to start reopening very soon. The governor put the Gaming Control Board in charge of reopening casinos, so they have to get permission from the Gaming Control Board before they can allow any occupancy, including restaurants. So the whole strip is still shut down at this point. As far as concerns, we did put out a guidance document for reopening, as well as a reopening checklist, which does highly encourage food establishments to flush their pipes 5 minutes at each faucet. And in addition, for our large resort properties, we have a pretty robust Legionella team that's been in effect for many years. They actually formed a task force, and a few more people were assigned to them for the COVID response. They sent out over 300 surveys to lodging facilities, including all the resorts, and asked them to fill out a baseline survey for their water system. And we had a task force that was returning calls. We had about between half and a third return those surveys. So staff are reaching out to everybody who returned the surveys. We're recommending that at least one person per property complete the CDC Prevent LD, Legionnaire disease, training and send that certificate back to us. And the ultimate goal is that they will put together a water management program. Mostly that's been done over the phone. There have been a few site visits. When we go out for a site visit and meet on property, they demonstrate how to flush lines. And then we also provided a flushing log for those lodging facilities in order to keep track of where they're flushing and for how long.
Okay, great. And this is sort of a follow-up. I know Michelle and a couple of other ones of you brought up concerns with imminent health hazards, and I was wondering if anyone else could expand on things such as lack of hot water, stagnant water, cockroaches, things like that in establishments that may have been closed or will be closed for long periods of time.
So this is Carrie from Wisconsin. Most of our facilities had remained open in the carry-out, take-out, delivery kind of capacity. So of course, if they had an imminent health hazard present, they would not open, and we would not want to see them open. So again, like I said, a lot of our establishments had remained open through the Safer at Home because they were allowed to do so. Really, there was just closures of your taverns, but those taverns too were getting really creative on things that they could offer for sale. So I really don't foresee a huge issue. Maybe in the city of Milwaukee, they might have some concerns with infestations or stagnant water, but in a majority of the state, I think a lot of people had remained open under the carry-out, delivery, curbside capacity.
Yeah, that makes sense. Sandra, do you have anything to add on imminent health hazards and protection against those?
For the few facilities we did have that elected to cease operations through this that are now reopening, we are actually going out and doing reopening inspections on those. Again, those are some that we are doing in person. That way we can be there firsthand. When our staff goes out, they have, they've got masks, they have gloves, they have hand sanitizer, then they have sanitizer for their own vehicles. So again, always, reinforcing that social distancing. Sometimes when you're in that situation and you're trying to get them reopened, you try the best you can. Sometimes it's not really easy to do. But those are, again, in that small group of them that we are doing in person. And they have to be, again, they have to be within compliance in order to reopen.
Thank you. So next, I would like to move on to looking at reopening aquatic facilities, if that's something that your jurisdiction oversees. If you could speak a little bit on what types of guidelines you've provided for reopening those or special measures that should be taken.
So with the overturning of the ruling, really all of our aquatic facilities can open, although we are seeing a lot of our municipal, with summertime pools opting to not open. During the Safer at Home orders that we were had here in Wisconsin, facilities that we were allowing to remain open, aquatic facilities, were your therapy pools, as long as it was only the patient in the pool and it was medically necessary, and it was limited to one person, and there was some disease prevention at the facility that was being practiced. Also those in-room jacuzzis for your hotel rooms, we were still allowing to operate with guidance and SOPs in place. And then, as I said, we have developed some reopening guidance on our Wisconsin Economic Development Corporation webpage. They've kind of taken the lead on housing those reopening documents. And then any special measures that we were looking for, again, we just want our pools to be operating as they normally would. And also it's very important that they follow those CDC fecal guidelines for accidents that may have COVID in feces, and the following those guidelines would take care of any concerns with COVID in feces. As for, inspectors, again, just following those standard operating procedures that are set forth by the business and using that social distancing. I know sometimes that might be difficult in a very small pump room. Again, the frequent hand washing, good personal hygiene, face masks, etc.
For pools in Nevada, they've been remained closed since March, the beginning of March. We entered phase 1, like I said, on, I believe it was the 9th, May 9th, and pools have remained closed, as well as spas. So those types of jacuzzis have remained closed as well. We have started talking with facilities, especially the resort properties and some HOAs about the reopening guidance. Of course, they have to decrease their capacity for social distancing. We're awaiting to hear what our phase 2 capacity is going to be. I just got information that our governor is going to be doing an update this afternoon. During phase 1, capacity was limited to 50% for all facilities. So as soon as we find out what phase 2 is and if schools will be able to reopen in phase 2, we'll provide updates on that. But we have warned establishments to be prepared for decreased capacity. Also increased cleaning and disinfection of pool furniture and restrooms and those that have locker rooms. We're recommending that they provide like spray bottles to patrons to use themselves, especially at HOAs where they don't have staff that can go through and clean multiple times per day. We did want to stress that they should not wear masks, especially the cloth face coverings, while in the water, because it's a breathing and drowning hazard. For those facilities that have lifeguards, we're recommending that the lifeguards do not share equipment like fanny packs, or if they do have to share equipment like backboards, that they are disinfected between each lifeguard, as well as the stands are disinfected between the guard rotation. And for the larger facilities, again, we recommended establishing traffic patterns so that there's the entry and an exit and walkways, kind of like what you're doing in the grocery stores. And as far as the water quality, while pools are closed, they're expected to be maintained. We have had an increased amount of complaints for green pools, so we are addressing those. But we do expect the water quality to be maintained, and we're not changing any requirements for water quality.
Great, thank you. So I'm going to move on to a few live questions from the chat box now. And we've had a lot of interest in your virtual inspections and how they work and what kinds of technology you use. So maybe if you can, all of you can expand a little bit more on how those procedures are working. Let's start off with Michelle for this one.
We have not done virtual inspections, basically just over the phone for complaints.
Okay, great. Sandra, can you expand a little bit more on virtual inspections?
Yes. So we took a very simple approach to this. We decided to try this using FaceTime, Duo, Zoom, something that's easy, that most people already have on their phones or is easy to download. So we have been setting this up in advance. So the inspections are not surprise inspections. They are scheduled. We make sure that the people know exactly what it is we're going to need and what we need them to do. So we've already contacted them and made an arrangement with them to say, hey, your inspection is going to be on Tuesday at 1 o'clock, and you're going to need this equipment so that we can walk you through the inspection. We direct what we want them to show us. So we say, let's go to the walk-in. Let's look at this. I need to see, let's temp the item that's in the yellow pan. Or so we're actually directing them as to what we want to see, where we need them to focus the camera. And they're taking the temperatures for us. They're showing us the test strips, and they're providing all of that information from their end. We are documenting it on our side, and we are able to immediately email them their inspection report. They send it back with a signature, and then we keep that for file. Again, we were trying to do something that was fairly simple, that we didn't have to have somebody download specific software for. So most, you either have an iPhone or an Android most times. So we picked the software that was most popular, and we're able to communicate that to them. And there's usually a manager that's got either an iPhone or an Android phone. And it's been very easy for us so far. We've had a lot of cooperation with it. A lot of them have, it's been very eye-opening, and we've used it also as an educational tool. We have, been able with the managers as they go through the inspections and them actually checking the temperatures for us as we watch. It's been educational for them to see where they need to do some improvement, and you would think that it being a scheduled inspection, everything would be spot on and perfect because they're waiting for us to call. And that's not the case. We are finding violations. And it's a teachable moment at that point, which we completely enjoy because we do a lot of ours with a lot of emphasis on education. So it gives us that opportunity to talk to the manager, and they can see it firsthand and make that correction right there. I'd be happy to share our protocol, and I can get that. I believe I've sent that to the NEHA office, and we can go ahead and get that out to anyone who would like to see it.
Great. Thank you, Sandra. That was a really helpful answer, and we can share that with anyone who's interested. And we have sort of a follow-up question to this about virtual inspections and whether there's any legal concern for virtual inspections as far as they are considered regulatory by statute or law. So those of you who do virtual inspections, if you have any thoughts on that.
I think because we've documented them as virtual inspections, we haven't had any concerns with that. I'm not sure what the ladies in the other jurisdictions are finding.
We have not had any concerns with it. We are documented it also as a virtual inspection. The forms all say COVID-19 virtual inspection on them, and we're getting agreement from the facilities in advance. So we have not had any issues.
Okay, great. So we have another question so a lot of our conversation has been talking about guidance and documents that we've developed and communicated. And someone has a question about training employees and verifying employee knowledge. And they want to know what kinds of procedures and things you've been doing on employee training and knowledge around new guidelines and things.
And is this food establishment employees or inspector employees?
It doesn't say specifically, so I think either one you can speak to.
I would say for our inspectors, as I mentioned, our director had conducted 2 Zoom meetings. So everybody meeting on Zoom and talking about guidelines that are being put out, instructing them on masks. And in the guidelines itself, I placed a how to wear a mask and the difference between masks that FDA created. So I put that in the guidelines as well. And basically talked about the alcohol, the use of the sanitizer. We really didn't stress gloves as much because they won't be handling the food. We especially stressed avoid high touch areas as much as possible. And in the guidelines, I included some high touch areas that would be in a food facility. So I think we tried as much as we could to inform our inspectors what to be careful of, what to watch for. However, we stayed away from, if you see somebody who looks like they have coughing, fever, then notify your supervisor.
Along the same lines, we have 2 different safety plans that we're following right now in our incident command system. We have a general safety plan for the district, and that is for all employees. And then we have an additional safety plan for environmental health. So we've provided information on the masks, pretty much everything that Michelle did that mentioned, and has links to CDC videos and the FDA infographics on those.
Okay, great. So I might move on to another question that's a little more general. And I'd like to have each one of you share some other questions that we haven't covered on questions you've received from the field that you think are pertinent and you can share additional information on. So let's have Carrie go first for this.
Well, a big question we've received from the field are who's going to enforce the safer at home orders? And of course, this is always directed, we're there for food safety. This is always directed in my situation. We have our local jurisdictions that sign a contract with the department. So really any sort of executive orders, emergency orders were or are to be enforced by our local law enforcement. So we always have just informed them that they need to send them to local law enforcement. That was a big question we were receiving as to what do we do, who do we turn this over to when we have concerns of people not following the safer at home emergency orders.
Michelle?
Same here. Local law enforcement is responsible for enforcing the health officer orders, specifically with food facilities, removing or closing off of self-service areas within food facilities is included in our what we call Appendix A. So we informed our inspectors to basically educate the operator, let them know that, hey, this is part of that attachment A. You might want to close that off. So you really can't enforce it, but make a note of it and discuss that with the PIC. So same lines.
Thank you. Sandra, do you have other questions from the field that you would like to share some answers on?
I think it's the same question everybody gets every day. When can we open? When can we open? But as far as they've touched on the enforcement aspect, and we've taken a little bit different approach here in Addison, Texas. So if it deals with the restaurant, we're going to go make contact with them and explain to them the latest governor's orders or the state or the county order so that they have the information from us. We'll make contact with them. Should they continue to not come into compliance, then the police department will pay them a visit, and that's when law enforcement becomes involved. But so far we've had a lot of compliance, just making contact and making sure everybody understands what we need to do right now. And the emphasis is really, it's right now, it's not forever, but we're all in this together. So let's all play nice and see if we can get through this. So that's our approach.
Yeah, that's a good approach. And then finally, Christine, do you have any additional questions you've received?
We also are getting a lot of questions about our governor's mandates. And so that's what the majority of the questions that we get are is, am I allowed to do this? Am I not allowed to do that? We do have a Nevada roadmap to recovery for phase 1, and there are specific requirements for restaurants, both requirements that have to be implemented and suggested best practices. So we get a lot of questions about the best practices. Do I have to implement them? And then specifics on what is mandated. We also get a lot of questions about enforcement of the mandate. So also we are not the enforcement agency. Our business license is the enforcement agency. So they're the ones that are going out and closing restaurants that are open who shouldn't have been open prior to phase 1 and enforcing the governor's mandate. Other than that, we're getting a lot of questions on about when can an employee return to work if they're sick. We're all following CDC guidelines on that, including the asymptomatic employees, asymptomatic people who have tested positive and close contacts for asymptomatic, close contacts to those that were positive who remain asymptomatic. Yeah, I'd say mostly it's just the governor's mandates, like do employees have to wear gloves at all times? We have not had that mandate. And I think a lot of establishments are trying to go out and find information on their own. And because there are such varied rules in different areas, that is causing some confusion on which ones we're enforcing and which ones we're not.
Right, that makes sense. Okay, so I think we have time for one more quick question. We have received a few questions on some of the guidance that's been discussed, and people are wondering if you have any guidance from your jurisdictions that you'd be willing to share, and maybe what those types of guidance are. And if you do, we'd be happy to put those on the NEHA website for people to access or share them out as needed. So we can definitely reach out to them later. Okay, we have also received a couple of questions on PPE and whether your jurisdictions have any kind of rules or mandates on PPE and whether that's different for food handlers and inspectors. So if anyone has comments on PPE.
So right now, our inspectors are not doing routine inspections, and it's our Department of Administration that usually comes down with what our PPE will be required. However, we have directed when we start going back out into the field, if there are certain PPE that facility requires, that they're to follow that, you know, their requirements for that prescribed PPE.
Okay, great.
Yeah, and our health officer order, as I mentioned earlier, Appendix A requires food employees to wear a mask. So that was the PPE that was required. And for our inspectors wearing a mask, as we mentioned, that we provided them. And of course, as Carrie mentioned, washing their hands probably more often than not, and using the sanitizer.
Great.
Yeah, and I'm sorry, I would just like to add, personally, I strongly discourage inspectors, like from using clipboards or anything that could be another source of contamination, something that they may set down. On a normal day, I really had discouraged against it, but just being really cognizant of those high contact areas and to avoid, us being a source of possible cross contamination with inanimate objects.
Mm-hmm. Yeah, that makes sense.
Mm-hmm.
And avoid handshaking.
And Nevada, our governor has also mandated that all food employees wear face coverings. So that includes front of the house and back of the house. And all of our inspectors are required to wear that as well. One of the things that I failed to mention earlier, since we are still doing inspections, is that we do have a policy in place where we are not requiring signatures. So normally, as the operator would sign for their inspection, they're electronic, but they would sign for them either using a stylus or their finger on the inspector's tablet. So we have put in a policy so that signatures are not required. We're just putting in a statement that due to social distancing, a signature was not obtained, but the inspection report is still emailed to the operator at the end of that inspection. And then we're asking for a reply email confirming that they received the inspection report. So that's cutting down on some of those high touch surfaces.
All right, thank you. And then Sandra, I'll give you the last word on any last PPE comments if you have any.
So we do provide the PPEs for our field inspectors. Again, the disposable masks, the gloves, the hand sanitizer, the sanitizer for their vehicles and all. We are encouraging everyone to use face coverings when out in public. That's the general public and everyone. It is not a mandate in Texas, but it is highly encouraged. For the restaurants themselves, again, face coverings and all for the wait staff, and additional hand washing or use of gloves. Again, we prefer the hand washing over the gloves because you literally have to change the gloves every time you go to a different person. So hand washing and use of the hand sanitizer is the best way to deal with that.
Great, thank you, Sandra. So it looks like we are at the end of our time, and I know there were still some questions that didn't get answered. So Laura and I will work on getting some follow-up answers out to people on those. And I just want to thank everyone again for attending, and I especially want to thank all of our panelists for being here today and sharing all of their great expertise with us. And I hope everyone has a good weekend. Thank you.
Thank you.
Thank you.
Thank
Stay
you.
safe.
You too.